Ready? Alrighty, here we go. We're gonna learn a couple of the muscles that we need to know for the axial skeleton. The quadratus lumborum comes and attaches on the inferior aspect of the 12th rib, to the iliac crest, to the TVPs of the lumbar spine. So whenever it contracts, what it does is actually brings this ilium up towards the 12th rib like that. So there's a lateral flexion inside the lumbar spine whenever it contracts. Whenever they're on the table, you're gonna palpate on the same side. So when I go over these, I'm just gonna teach you as if I'm the one taking the practical. I'm gonna show you what I expect, okay? So I'm not gonna cross midline unless I specify that I'm teaching you that way. Cool? All right, for the QL, are you okay if I see your skin right here?
Mm-hmm.
All right. So make a skin-on-skin contact. I want you to come where the TVPs of the lumbar spine are. Find that 12th rib, find the iliac crest, and then you're gonna be right there at an angle. Because I'm on this side of the table and you can't see because of the video, I'm gonna show you where it is on that side, only for teaching purposes, okay? So 12th rib, iliac crest. I'm gonna do that a little slower. Iliac crest and the 12th rib are right here. These are the TVPs because this is midline, and I know the TVPs are about that far out. From right here, here's the QL. When I get them to contract it, we're gonna say, bring this hip towards this shoulder for me. Good job. And then I'm gonna feel for the contraction, relax, and do that exact same thing one more time. Perfect. Muscular contraction. Good. Don't cross midline. Stay on the same side that you're doing it. Be right here. Good. The next muscle is gonna be the glute max. That's a super easy one. So we're gonna say, can you do a straight leg raise up into the sky for me? Perfect. And hold right there. Glute max, muscular contraction. Down. Next one is gonna be glute med. The glute med attaches a little more lateral on this ilium. So when you're contacting it, I want you to be around this region. If I'm gonna show you on him, here's his iliac crest right here. That glute med is most likely gonna be right there. To find it, we're gonna ask for him to contract. The way that they contract the glute med is through this abduction. So from this point, find the iliac crest, I come just right down. I say push your leg out towards my hand right here, like a jumping jack. Good, and relax. Muscular contraction of the glute med. The next one is the piriformis. It's a little tricky. It's on the inferior 1/3 and anterior aspect of the sacrum. It comes out back here and then attaches onto this trochanter. So when it does that, what happens to this femur is it externally rotates because the trochanter tries to get closer to the sacrum. If his foot is in this position, external rotation of the femur is gonna make this happen. All right, I'm gonna show you on that side so you can understand the attachment points. The trochanter needs to get closer to the sacrum right here. In order for it to do that, the muscle contracts and it goes like this. So the trochanter swivels posterior medial. So when I ask them to contract it, I'll be on the same side. This is what it'll look like in your practical. Find that inferior 1/3 of the sacrum. Find the trochanter. To find the trochanter, you can swivel his hip and feel the bony resistance of something swiveling like a knob underneath your hand. I go right in the middle of those 2 points. And I think that this is where the piriformis is, but I'm gonna feel. So I'm gonna say, can I have you pull your foot midline that direction? Good, and pull. Perfect, and relax. I can't feel an activation of the piriformis, so I'm gonna do it again. And pull, and relax. Good. So it's not there on him. It may be a little more lateral and superior for the muscle belly. One more time, pull, and then relax. Good. So he activated a couple different muscles. Know that it's underneath the glute max, so you're gonna feel a different contraction as well. But I can feel the muscle of the piriformis contract on the 3rd time that happened. Good. Make sure that the foot is being pulled midline. That's the contraction of the muscle. All right, last one on this is gonna be the TFL. Can you go face up for me? It's the pocket muscle. So if you see on my pants, here's a seam and here's the pocket. This is where the muscle is gonna be. This is where my ASIS is. Do not come anterior like this. It's gonna be on the lateral aspect of the ASIS and right where the pocket region is. Here's his pocket region. This is where you would palpate. For the activation of that muscle, what they're going to do is they would internally rotate their foot and then they're going to raise the leg towards the sky and hold right there for me and then relax. That's going to be the muscular contraction on the TFL that you can feel. So usually the gowns cover that region, so ask for them to bring the gown up to belt line so that you can see where the ASISs are. All right, Chris, are you ready for Pepe here? From this point, I'm right in that pocket region, right there. I'm going to stand on the same side. I'm going to ask him to point your toes towards midline or towards your belly button. Right there we go. And then raise your leg up towards the sky and hold. Muscular contraction, left TFL. Good job, and down. All right, that's pretty simple. If you have questions, look at the netters, look at the muscle attachments, and then see if you can get one bone to approximate the next bone and what action would that require. All right, thanks.